May is Mental Health Awareness Month, a National Foster Care Month as well. And today we're taking a look at the challenges specifically facing our foster youth. And joining me now with more on this, we have Dr. Jill Alt, Mental Wellness Director at Just in Time for Foster Youth. And I want to thank you for being here.
Thank you.
This is such an important topic to talk about because I have just learned, just by talking to you right before, during the break, 80% of youth in foster care in just the state of California are facing some type of mental health issue. Can you talk a little bit about that?
Absolutely. Yeah. I mean, if you figure when you've gone through foster care, you're going to have much higher levels of family disruption, adverse childhood experiences, maybe lack of resources, separation. So you're going to be much more prone to mental health issues, physical issues as well. So your level of your adverse childhood experiences scores are higher, and you're much more likely to have an array of mental health problems.
And you're working directly with some of the, well, I would say young adults, because Just in Time deals with some of the, well, I should call them kids, right? They've aged out.
They've aged out, 18 through 26.
Yeah. And so you're working directly with them. What are some of the struggles that you see they're facing?
You know, a lot of them are the same struggles that a lot of, 20-somethings are facing right now, but it's just intensified for them. So they're dealing with a lot of depression, a lot of unresolved trauma, a lot of attachment issues, relational problems, a lot of anxiety. And I think what's missing for a lot of them is they don't have necessarily the same support system that maybe another 20-something has. And so that's a lot of what we're trying to do at Just in Time, is come along beside them and really create a community of support while they go through that.
Are you finding that they're able to identify these issues, or is it just a matter of they're having a hard time bringing these things up?
No, I think they identify it. I think they identify it. But a lot of our young people, they haven't had good experiences with mental health when they were kids. They were maybe forced to do it, and it wasn't a happy thing. It wasn't a choice. So one thing that we're trying to do is say, it's here, we're available when you're ready and you want it. And what I'm finding is that people are wanting it, and they're seeking the service, and they're ready, they're open, they're very insightful, they're very aware of what's going on with them.
And if people at home are listening and maybe they know someone who's maybe going through this or can identify with this, what can they do to help, I guess, if they notice that someone is going through the mental health, some of the difficulty that they face?
If they're a former foster youth, if they've, absolutely, you can reach out to Just in Time. We're offering, we have a lot of services and resources that we offer, but when it comes to mental health, we're offering completely free therapy, which is really unheard of. So if there were somebody who has gone through the foster care system at all, even just a day in foster care, have them reach out to Just in Time, and we'd like to support them in that.
And I think, I mean, this is something I feel like a lot of us might take for granted. We come from a home, we've got mom or dad, and they're there for us, and it's been one home, whether or not you're moving all the time. And so when we talk about fostering and children moving from house to house to house, foster family to foster family, how does that tie into some of the mental struggles that you're seeing them facing?
That's a great question. I think it's huge. I think that kind of disruption and disconnection and relational detachment, I think, is really the undercurrent of what we see and why people are having a lot of difficulties. So with the mental health that we're offering, we're really trying to focus on helping with those healthy attachments again. And Just in Time also, I mean, our model is based on building community and finding supports. And so I think it's very kind of holistically looking at those issues.
You mentioned something, building healthy attachments again. I mean, we're talking about young adults, and the world is just difficult to live in as is.
You're right.
So for them, are you finding that they're able to do that after getting help?
Yes. I mean, yes. I mean, they're doing better. We all need help with that, right?
Yeah.
But, I like to say that healing really happens in relationship. It happens in connection to people. So the more the people are there and building those healthy attachments and feeling safe and feeling cared about, they're better able to go out and do that for themselves and find healthier connections in the rest of their life.
Well, I'm so glad that you're here to bring awareness on the issue. And here's the thing, if people at home want more information on what Just in Time for Foster Youth is doing, they can go to our website, fox5sandiego.com, click the Scene On tab, and we'll make sure that we've got the links to link you up with Just in Time. So thank you so much for being here.
Thanks for letting